Hello, it's Tuesday Talk at AIYANA Aesthetics. I'm Rebecca Kelly, nurse practitioner, and today we're going to talk about how much Botox do you really need? So this has been something that's been asked quite a lot often, and I just want to address, how much Botox do you need when you come in and you're wanting to get the results that you want to get. So every person is different, every client is different, and getting a really good, thorough consultation and coming up with a treatment plan with your provider is always going to be the best option. So this is very just general, basic, kind of what we go off of per area on the face. But everybody's different, so make sure you take that into consideration. So Botox is dosed, Botox, Dysport, ZMN, all of them, they're dosed per unit. And it's a little bit different dosing than like if you were to just take a different medication like a Tylenol. It's, 500 milligrams. So Botox is different in that way. So when people sell it, it's typically sold per unit. But how many units do you actually need? So when we're doing an assessment and looking at somebody's face, we do know that certain areas, like I said, of the face need different amounts of Botox to get the result that you want to get. I personally always like to start out low and then we work our way up, because I would rather you still have a little bit of movement in your face and still be able to have your smile lines than to just be completely frozen, okay? That Botox frozen look that people are always worried about. So we'll start at the top of the head and then we'll kind of work our way down. Most of the time Botox is just used in this area of the face, okay? So usually Botox is up here, fillers are down here, okay? So that's number one. A lot of people get confused, the difference between Botox and filler. Botox is just used to weaken the muscles and to soften them, okay? So basically it goes in there, it's injected into different muscles on the face to help weaken them. Filler, when we use it down here, filler is for volume. So filler is what you're going to use when there's volume loss, okay? So like when you kind of get the deeper nasolabial folds, maybe the deeper marionettes, maybe the jawline isn't as structured as it should be, or, a little bit of fat pad movement, or, fat pad starts to move down and you kind of lose that cheek. So that's what filler is for. So let's start at the top and we'll kind of go through each area of the face and talk about how much Botox would we need. So the forehead, it's a very big area, but actually the muscle is very skinny. So it's almost like just a flat muscle on top of the forehead. So typically in that area, I would do between 6 and 12 units, depending on how big somebody's forehead is, how much movement they have, how deep the lines already are. So for me personally, I do about 8 to 10 units on my forehead. And that's pretty average for most people. The next area we'll talk about is the glabella. So this muscle basically just comes right in between here, and it's thicker. I mean, you can pull on it. It's a thicker muscle right there. So that one actually needs more Botox than this, which is kind of crazy. So usually here I go between 15 and 25 to 30 units right in there. Generally, most people are around 18 to 24. That's about how many units you'd be getting in that glabella, okay? And then we would go to the crow's feet. So the lines around the eyes, typically for that, I would be between, I would say 8 to 12 units on each side, okay? We can also do a little eyebrow lift with Botox where you're getting a little bit more lift in the brow. It's very subtle, and usually we can add it into when we treat the crow's feet, which is what I typically do. I give the brow lift right here and then I, inject around to get the crow's feet. But that's about 2 to 3 units each side, okay? The other one that I love doing with Botox is the jelly roll. So do you see that little, you get a little rolls down here, or even a little bit of those fine lines? You can actually do some what I call baby Botox, diluted, and that we can inject right underneath the eye, and it helps with those lines. I get that done too. So that one is about 2 units on each side, okay? Bunny lines. So these little lines, when you scrunch your nose, some people have it more when they smile, they can see those lines. That's typically 2 to 3 units on each side. Okay, so now we're down here. So I did say Botox is mostly up here, but there are some little tricks of Botox that we can do down here just to get a little bit of some results that I'll kind of talk to you about. So people who have a gummy smile, so when you smile and if you see more of your gums, we can actually Botox on each side of the nose, 2 units on each side, and it just relaxes that so that when you smile, you know, I don't have a gummy smile, but when you smile, it would just hold down your lip, okay? It wouldn't curl up as much. Then we can talk about a lip flip. So the lip flip is something that when you Botox along the lip border, it's going to accentuate your vermilion border. So it's going to give you more of a crisp border here, but it also is going to just kind of see how it does that with the lip? Just kind of makes the surface area of the lip kind of flip up a little bit more. So not volume, just kind of more show of the lip. Another spot we can Botox is when you frown. Right down here is a muscle that actually pulls the corner of your mouth down. So if you notice that you have like a frowny face when you're just at rest, we can actually put 2 units on each side here, and it will relax this muscle and allow the corner of your mouth to go back up. One of my favorite treatments that I actually get done is in your masseter. So people who clench, grind, who have headaches, you can Botox this muscle back here, and it is humongous. See, I can kind of pinch mine right there, okay? You can Botox that and it will relax it so that you don't have that pain. That's a great treatment. It's a little bit, that muscle's huge, so it's gonna take more. So it's about, I start out at 10 each side, but usually we get up to about 20. So it's about 10 to 20 units on each side. But the good news about it is that it lasts longer than all the other Botox sites. So this site lasts about 5 to 6 months. All of this up here lasts about 3 to 4 months. And then this around your mouth, because just as I'm doing right now, we're always talking, this lasts about 2 to 3 months. So I think that's it. There you have it. All the fun little areas that we can Botox and how many units each of them take. So of course, just make sure you schedule a free consultation to see us, and we can come up with a treatment plan just for you. And of course, if you have any questions, be sure to reach out. Make sure you subscribe down below. Thank you so much for following along. Like and share this video, and we can't wait to see you next time. Bye-bye.